Sterile technique. So I would start with going in to visit my client. Knock, knock, knock. Good morning, Mr. Smith. How are you today?
I'm good.
So, Mr. Smith, I'm just checking your name band. Can you tell me your full name?
Mr. John Smith.
Great. So how was your night, Mr. Smith?
A little uncomfortable.
Oh, so what's feeling sore at the moment? Why do you feel uncomfortable?
My tummy hurts.
Oh, okay. I understand that's where you have your wound. So I might just have a quick look at that if that's all right with you.
Yes.
Okay. I'll just do some hand sanitizing. Oh, Mr. Smith, I can see that, someone has put some towels over the top of your wound here, and it looks like it's actually seeped through. So, if it's okay with you, I just wanted to see what your pain level is at the moment.
2?
Okay, and that's in your abdominal area?
Yes.
Okay, and how would you describe the pain, Mr. Smith?
Just uncomfortable.
Okay, more like is it achy or itchy?
Maybe a little bit itchy.
Okay.
Just general sore.
Sure. Is this something that you feel that you need a little bit of analgesia before I start your dressing change?
No, I should be okay.
Okay, I'm hoping that once we do your dressing change, your comfort might improve.
That would be nice, thank you.
So if it's okay with you, I will go ahead. I just need to also introduce myself, which I didn't do. So Mr. Smith, my name is Tony and I will be your nurse today.
Hi, Tony.
Okay, thank you, Mrs. Smith. I'll go and collect my everything. I'm just going to leave everything as is if that's all right with you.
It is.
Okay. So I'm coming out, I'm going to have a look at Mr. Smith, who's actually Mrs. Smith, Betty Lou Smith. I'm just going to see that she does have an abdominal wound. It started on the 2nd of February. I read in the notes beforehand that she actually spilt some coffee onto her abdomen and that caused a little bit of a burn on her abdomen. And my understanding is that she did have a blister, but that did burst. I'm going to have a look at the care plan. So they're saying that we need to cleanse the wound with normal saline, pad dry, apply non-adherent cover dressing and secure with tape. And it needs to be changed every 2 days. I'm actually going to talk to the RN after I've done the dressing because I feel with that amount of extra date that this wound may need to be changed more often. And because of that, I am going to change the type of cover dressing for something a little bit more absorbent. So, okay, I'm going to collect my supplies. Take this with me and I'm going to keep the I'd like to just clean down my surfaces. Okay, Mrs. Smith, I'm going to take that dressing off, okay? Let's get that off and see what's going on. And how are you doing? You okay?
Yeah, I'm okay.
Good to hear. Okay, I'm just going to lift up your gown a little bit. I'm going to remove this, and I see that the dressing is quite saturated. Gently remove it. Don't want to pull that on the skin. Okay. And I see that there's a copious amount of serous sanguinis exudate. Okay, let's get everything set up. Okay, so I have my dressing pack. I'm not going to be using this non-adherent, I'm going to be using something a little bit more absorbent. Got some extra gauze, I've got my measuring tape, and I have my gloves. I also have my saline that was opened yesterday at 9 o'clock at night. All my packaging all looks intact. No expiry dates, everything's still good. Excellent, not using that. And everything's nice and intact. Okay, start off with my tape. Just opening up my drape to use to protect the bed. Face the shiny side down. Good. Peel back my packaging. Two ways I can do this. Or open up. I prefer to use the forceps. I trust it better than my drop it technique sometimes. Except now I'm going to prove it's wrong. My measuring tool. Okay. Don't really like how that ripped, but I can still see that I'm still sterile. I won't need that piece. I really don't like how this ripped open. I would actually be getting another one. Thank you, Fiona. Because as I've ripped it, you can see that I've contaminated the side of the tool. That's all right, Fiona. We'll keep moving.
I can grab mine from my bag if you want it.
Let's keep going. Let's all pretend this is still sterile. I might cut this bit out.